Hi, this is Rich Sanders, and welcome to the Health Law News Nugget for March 13th, 2018. Well, the Sanders family is on spring break here in Orlando, Florida, but the healthcare world of business and politics keeps on spinning. So we're bringing you the News Nugget live from Orlando today. Big news last week from Wall Street was that the insurance company Cigna decided to acquire Express Scripts, announced this late Thursday, for $52 billion. For those of you who've been following the News Nugget for a while, you'll know that this is part of a trend of consolidation in that part of the healthcare industry, where Aetna was acquired by CVS Hallmark earlier in the year, and Berkshire Hathaway announced its joint venture to try and transform healthcare and manage the cost of its employees better. This Cigna Express Scripts move is consistent with that in the changing of the landscape of healthcare delivery, specifically by utilizing pharmacy benefit managers, or PBMs. There's a lot of controversy about these kind of companies. Express Scripts is a competitor of Caremark CVS, and although there's a difference of opinion as to whether they're increasing costs or managing costs, they're clearly part of the strategy for insurance companies and others who are trying to manage the cost of healthcare, because they're directly in play in so many of these transactions. The question remains to be seen, one, whether these kinds of transformations will be effective at a large macro scale of managing healthcare costs, and two, whether they'll do the companies any good. On Wall Street Friday, the the Cigna stock closed 11% down, while Express Scripts stock closed 8% up. So Cigna investors weren't thrilled with the deal, but Express Scripts investors were. Only time will tell as we head into yet another round of healthcare regulation. The Trump administration announced last week that it's proposing some rules we'll talk about in next week's Health Law News Nugget. Meantime, if you're in Orlando, please look for me at the welcome reception for the RPA, Renal Physicians Association. I'll be there Thursday night, and many of our viewers, who include hospital administrators, physicians, physician practice managers, and folks who work with pharmaceutical companies, will be in attendance. So I look forward to meeting you in person then in Orlando. Meantime, have a great week, enjoy some sunshine wherever you are, and we'll look forward to seeing you next week in the Health Law News Nugget. I'm Rich Sanders with Southern Health Lawyers. Have a great week.